as children, we need to be protected from polluted air and given healthy food options
for us and the planet.
We need places to play and run,
and safe roads for crossing. We deserve clean water to drink
and to be safe from climate emergencies.
Protect the environment, and you protect our rights too.
El año pasado, el mundo aprendió que tenemos voz. Not that we didn't know that already.
今年はもっと言いたいことがあります。
My health is as important as your health.
Y mi éxito es tu éxito.
Y success y tú. We want to live in a world where we can access clean water.
Y tener también alimentos sanos. Sin tener que respirar esto cada mañana.
Or walk past this.
なんでこんなにたくさんの宣伝が私に向けられているの？
I'm only 10.
Solo tengo 5.
¿Este es el futuro que queremos?
Otwapumbwanye tulonge pwamwe.
Matambuzito edu, matambuzito epasirese.
Y yo estaré aquí más tiempo que tú.
Construyamos un mejor mundo para todos.
Including me.
Y a mí.
Y a mí.
Lena.
So dance on wir kan kendens wies.
Good morning, good afternoon, and good evening, everyone. I'm Evelyn Santiago, and I'm the Executive Director of the ARNEC Secretariat. I warmly welcome you all to this online launch of the ARNEC Connections 2020 edition, with the theme, Ensuring the Well-Being of Young Children Amidst Environmental Risk in the Asia-Pacific region. This edition explores the nexus between early childhood development and the physical environment. It looks at how various environmental risks and hazards can affect young children's overall well-being and development. This theme reinforces the discussions and agreements we've had at the ARNEC Regional Conference on ECD held in Hanoi in December of 2019 and the Hanoi call to action that emerged from it. This ARNEC connection amplifies the key message and commitment we made at that conference. Young children are the most vulnerable to the impact of poor environmental health, and that there is a need to work across all sectors with the engagement of families and communities to promote safe, nurturing, sustainable, and resilient environments for young children. In ARNEC, we stand by our advocacy and commitment to ensure young children's holistic and inclusive development. The larger context within which children develop, including the physical environment, has an impact on the quality of such development. As conveyed in this edition of the ARNEC Connections, the poor health of the environment exacts a heavy toll on young children, and if not addressed, will undermine collective efforts to achieve national and global targets in the Sustainable Development Goals. Today's event has 3 objectives. Joel, can you get to the next slide? First is to build awareness among partners in the ECD community in the Asia-Pacific region and beyond of ARNEC's advocacy on the interlinkages between ECD and the physical environment. Second is to present key findings and advocacy messages from select articles in the 2020 ARNEC Connections. And finally, we will launch officially the 2020 ARNEC Connections. I would also like to take this opportunity to thank all the members of the editorial committee of the ARNEC Connections led by Margaret Sims, Honorary Professor of Early Childhood, Macquarie University in Sydney, Australia. Our gratitude also goes to the Open Society Foundations and the Bernard Van Leer Foundation for supporting the publication of the ARNEC Connections. Finally, I'd like to introduce Ms. Sarah Dang, who will be moderating today's session. Sarah is the chair of the ARNEC Executive Committee and Save the Children's Senior Advisor for Asia. Again, I welcome you all to this launch, and I now give the floor to Sarah. Over to you, Sarah.
Thank you, Evelyn, and welcome everybody. It's wonderful to be together for this exciting launch of ARNEC Connections. A few gentle reminders before we get started. So this launch is going to be recorded and all the resources will be shared and made available on the website afterwards. You can also use the question and answer feature in your Zoom meeting control to ask any questions. And please, if you want to upvote, you can click the thumbs up. Please also feel free to ask questions during the presentation and we'll collect them and we can ask them afterwards during the Q&A session. Please also sign up to become a member of ARNEC on the ARNEC website and follow us on Facebook. And we would like to request your feedback on the activity. So there's going to be a short survey that we'll be sending after the session that we would really appreciate if you could complete. Thank you. So I'd now like to introduce our first speaker, and this is Dr. Bernadette Delmans, whom we all know for her incredible work and commitment to young children, and her leadership in developing the Nurturing Care Framework. Bernadette is a team coordinator in the Department of Maternal, Newborn, Child and Adolescent Health in WHO. And Bernadette managed the secretariat of the steering team that prepared the Lancet series Advancing Early Childhood Development from Science to Scale, and was a member of the Lancet Global Health Commission on High Quality Health Systems in the SDG era. Bernadette, we're looking forward to your presentation.
Thank you very much, Sarah, and good morning, good afternoon, and good evening. Greetings from the World Health Organization in Geneva. It's with great pleasure that I participate in this launch ceremony of the 2020 issue of ARNEC Connections, dedicated to the role of the environment in ensuring children's health and well-being. It's just over a year ago that several or maybe many of you were present at the conference that ARNEC convened in Hanoi on the theme of working across sectors to promote nurturing care and sustainable environments for children. At that time, political leaders and participants representing multi-stakeholders agreed that the threats in the environment were real and urgent actions are needed. Next. Next slide, please. At that time, we could not anticipate that a few months later, the world would shut down because of a virus that was new and beyond what our systems could handle. It has brought major hardship, economic, social, and emotional, and led to excess mortality at an unprecedented scale. But it has also led us to find new solutions and strengthen our resolve to tackle intractable problems. Also, in February last year, the WHO UNICEF Lancet Commission released their report, A Future for the World's Children, raising the alarm that the health and rights of all children and adolescents are under threat. Next. Next, please. The authors demonstrated how rapidly changing climate, air pollution, and environmental degradation, mass commercial marketing of harmful products such as sugar, fast food, tobacco, and alcohol, unplanned urbanization, and growing inequities in economic, educational, and social opportunities are hampering progress and undermining sustainable development. These are factors that directly affect children's health and development. They are common in countries of the Asia-Pacific region, and unless we take action now, the gains achieved in improving child survival may actually not be sustained. Next. The harmful effects of climate change and environmental threats affect all stages of the life course. It's estimated that about a quarter of all childhood morbidity and mortality globally are due to environmental factors, including air pollution, lack of water and sanitation, poor hygiene practices, and the presence of environmental toxins. As you can see in the infographic in the middle, almost all children in Southeast Asia and the Western Pacific are exposed to poor quality air that exceeds the WHO safety margins. All these risks are preventable, and the cost to benefit ratio of interventions is very high. Benefits last a lifetime and are carried into the next generation. Unified and coordinated actions led by heads of states and governments are therefore urgently needed. And the new WHO strategy on health, the environment, and climate change, released in 2020, provides us some directions to guide and catalyze the transformation. Next. A brief reminder that we also have the Nurturing Care Framework, a roadmap for action. It calls for a broad-based approach that is grounded in family-friendly policies, services, and community systems. The framework recognizes the importance of the environment as a critical determinant of children's health, development, and well-being, and it demands us to adopt a whole-of-government and a whole-of-society approach to leave no child behind. Next. Countdown to 2030 for Early Childhood Development is an initiative to spearhead advocacy and accountability for children's health and development. Its analysis of data in 197 countries released in 2020 has shown that on many indicators, countries fall short. For example, fewer than half of infants younger than 6 months of age in almost all countries were exclusively breastfed. And in almost half of the countries, 3/4 of children 1 to 4 years of age were exposed to violent discipline by their caregivers. Moreover, in 1/3 of the countries, less than half of children received responsive care by adults in their home. Critically, the profiles, as they are, include few indicators that are related to the environment. And this is a gap that needs to be filled. Next. Tackling environmental threats and building sustainable developments has widespread ramifications, often beyond what each of us as an individual can handle. Approaches are needed that harness the strength of each stakeholder, including local government, civil society, and private sector, and involve sectors such as energy, transport, and urban planning, alongside health and education. Importantly, the voices of children must be heard, as it's their lives that are in the balance. To capture best practices and share lessons learned, we are fortunate to have active partnerships like ARNEC, and to have access to virtual platforms that enable us to communicate and exchange, such as provided by the ECD Action Network and the Nurturing Care website. Next. There are many resources that you may want to keep track of in dealing with our agenda. The Children's Environmental Health Program produces a quarterly newsletter, an example of which you see on the left. Technical resources and training materials for healthcare providers are also available on the WHO website under the topics of environmental health and children's environmental health. Here, I show the briefs on chemical safety in schools in the Philippines and on clean, safe, and secure environments to support early childhood development. The Nurturing Care Handbook is a new and living document with tips to implement each of the 5 strategic actions of the framework. It will be available on the Nurturing Care website on 1 February, and we invite you to use it and give us feedback on its usefulness through an online consultation platform. Next. And finally, I like to salute the Secretariat and the authors of the 2020 ARNEC Connections. The current issue makes a very important contribution. The themes that will be elaborated by the speakers that follow me provide a rich palette of facts and actions, of commitments and possibilities that can inspire us all to address environmental risk factors that hamper children's development. They inform next steps that can be taken to work towards the Sustainable Development Goals protect the environment, and enable children to survive and thrive to transform health and human potential. I'd like to thank the Secretariat. I'd like to thank you all participants and look forward to the presentation and the discussion that will follow. Thank you.
Thank you very much, Bernadette. It's always really insightful to be able to hear your perspective, and also for sharing with us all the different resources that are available to support this particular area of work. I would now like to present to you the authors and an overview of the articles in the 2020 ARNEC Connections. We have first an article by Dr. Ki-dong Park, who wrote about clean air for children's health. Peggy Chua, who wrote about air pollution and ECD in the Asia-Pacific region. Garma Gele, who wrote about the environment for healthy development of young children, the policies and practices of a carbon-negative country. Sirita Sulzikasaikan, who wrote about ECD and air pollution in Mongolia. Thi Chao Nguyen, Liv Leroy, and Sri Nguyen Din Keung, who collaborated to write Growing Up in Cities, Empowering Early Childhood Services in Da Nang, Vietnam, to deal with urban barriers to learning. And Dr. Maria Raquel Dal Costa and Dr. Silvana Birchenov, who wrote about raising awareness of climate change and ocean acidification effects on young children's development. Then we have Caroline Isame, who wrote about nature and the brain, the answer is in the trees. And Julien Vincelot and Esther Go, who wrote about the Green Blue Schoolyards, an effective investment for early childhood, nature, and climate. We've now invited selected authors to share with you just an overview of their articles. Our first speaker is Dr. Park. Dr. Park, over to you.
Thank you, Sarah. Good morning, good afternoon, and good evening. My name is Dr. Ki-dong Park. I'm the WHO representative in Vietnam. It is my great pleasure to talk on clean air for children's health at the launch of the 2020 Asia-Pacific Regional Network for Early Childhood Connection. I believe that clean air is an essential for health and development for children, especially during early childhood period. From smoke hanging over cities to smoke inside the home, air pollution poses a major threat to health and climate. Air pollution may not always be visible, but it can be deadly. Globally, air pollution causes 7 million premature deaths each year, including more than 5 million deaths due to NCD. WHO estimates that air pollution is accountable for 29% of all deaths from lung cancer, 24% of deaths from stroke, 25% of deaths from heart disease, and 43% of deaths from lung diseases. We can call air pollution the invisible and silent killer. Though air pollution affects everybody, children are at great high risk than adults for many reasons. Each year, air pollution causes 570,000 deaths in children under 5. When we expand the scope for all children, nearly 1 million children die from pneumonia each year. Half of these are linked to air pollution. Evidence on impact of air pollution in children's health is growing. Air pollution has health impact on the health of fetus. In children, air pollution can cause disease in brain and lung, as well as cancer. There's also clear, compelling evidence that prenatal exposure to air pollution can predispose individuals to cardiovascular disease later in life. We all have a part to play in protecting children from dirty air. Air pollution can be fought on many fronts, including houses, clinics, schools, institutions, municipalities, national government, and global community. At the level of the global commitments, there are resolutions adopted by the World Health Assembly. There are also political declarations adopted by the United Nations General Assembly. In 2018, WHO published a report summarizing the latest scientific knowledge on the links between exposure to air pollution and adverse health effects in children. WHO has also developed a set of recommendations to help protect our children from air pollution, which are also to follow, easy to follow. 6 ways to help protect our children from household air pollution include: don't smoke indoors or near children. Use cleaner fuels and technologies to cook, heat, and light your home. Use ultra-low emission stoves with processed solid fuels if cleaner options are not available. Always cook in a well-ventilated air or outside. Avoid using kerosene lamps or stoves for cooking or lighting. Don't burn candles or use air fresheners. Another 6 ways to protect our children from ambient air pollution are: stop burning household and agricultural waste, reduce air pollution caused by vehicle exhaust emissions, keep your children healthy, maintain and improve monitoring system for air pollution, follow with air quality and effect of air pollution on your children to know when and how to take protective measures. Raise awareness among your community about the health impact of air pollution. Children are society's future, but they also is almost vulnerable members. For our health children and health future, action should be taken urgently to bring clean air back to our planet. We all have a part to play in protecting children from dirty air. This is outline of my article in the connection. Thank you.
Thank you very much, Dr. Park. We really look forward to reading this article. We will have questions afterwards. We'll invite our next presenters, Dr. Maria da Costa and Dr. Silvana Birchinov. Over to you.
Good morning. This is Dr. Maria Raquel da Costa. I'm an ECD specialist. Good morning, good afternoon, and good evening from Portugal. We are presenting our paper with regards to the awareness of climate changes and ocean acidification effects on young children's development in the Asia-Pacific region. And I think I'll pass it over to my colleague Silvana. She will.
Yes, thank you, Maria. Good morning, good afternoon, good evening. My name is Silvana Birchinov. I'm a scientist. I work for the Center for the Environment, Fisheries and Aquaculture Science, CFAS, in the UK. And this is a collaborative study between Maria and I looking at several effects. Next slide, please. Just to give a little bit of context, as we listen to one of the opening remarks from Bernadette, we have several aspects when we talk about the physical environment. And particularly, we listened just the previous speaker about air pollution. Today, I want to talk to you about something which is also very important, happens in the oceans. And I give you a little bit of background in regards to climate change and ocean acidification. As the increased CO2 emissions from the atmosphere as a result of human activities are buffering to the ocean, we have a resulting lower pH, which changes the chemistry of the seawater. These changes will have implications for some of the organisms, as you see here, the calcareous organisms that depend on formation of shells and exoskeletons. As these changes are starting to modify some of these species, we'll have some specific changes for the commercial species, which are important for food security, but also those changes will have a specific repercussion for young children in the region. As we said before, the oceans have many challenges, marine litter, pollution, but ocean acidification is something that we can't really see immediately. We only see it through the changes in the organisms. Next slide, please.
The implication of changes for the ocean for early childhood development are several, and some of them are happen at different levels, and some of them are at the moment for us invisible. But I think I would like to focus on 6 ones that are important. Those are the most, considering that they increase the vulnerability of children. So in this summary, we deal with those 6. First, the implication for food securities and resulting from that changes in diet with the loss of important nutrients for mothers, in particular pregnant mothers, the loss of protein, or for children, the loss of protein, omega-3, iodine, selenium, and zinc, which are important for the brain development of young children. The second one, and I think is most important also for the nurturing care, as the families need to find new sources. As the oceans are changing, the foods are disappearing, quotas are being applied to extraction of sea products, parents have to look for alternative sources of income, changing the patterns of interactions that they have with their children. And in Asia Pacific, has been observed that mothers sometimes have to leave the children behind when the immediate source of income disappears. Likewise, when the family have to move and look for new sources of income. Also, as oceans are changing, natural disasters sometimes happen, and there is the added stress to deal, which affects the emotional development of children, and in particular with consequences of not having regular access to early learning. Sometimes preschools are closed, or sometimes they are too distant, and sometimes the families are taken to areas of safety where children and families are not in contact with early learning, and they miss out great opportunities. Next, please.
So how we look at this in terms of solutions and policy actions. As we said before, the seas and oceans are very important in the livelihood of Asia-Pacific children. So we propose, first of all, consideration of multisectoral approaches in terms of policy, but also in the actions. We need to be able to think about what are the priorities, but also build a nation in which the human capital actually are able to take great care and minimize the effects of acidification on commercial species, but also with regards to children's rights with early childhood development.
When talking about physical environments, it's important to include the ocean and not just making a case for keeping the oceans free and clean of litter. Also, I think we call upon the big producers of CO2 to consider children's health, children's future. And by raising awareness and educating parents that oceans are changing, especially for those in the coastal areas, which is most children in the Asia Pacific, the safety and protection of children is paramount and is important and shouldn't be delayed. Working towards securing the rights of the children to live in a safe environment should be the sure quest of all people who deal with children. And I think policymakers, as we said at the end, should take into consideration the clear profits of ECD in building human capital, and also in reducing the social inequalities, fostering sustainable environment, and promoting peaceful societies. Next, please. We would like to thank you very much for your attention. I'll pass over to Silvana to say goodbye.
Thank you very much for listening, and we're happy to take any questions or comments. Thank you, Maria.
Thank you.
Thank you very much. That was, again, fascinating, because often we've talked a lot about air pollution, but the oceans are also such an important environmental context for young children, especially in this region and with the Pacific. So thank you for that perspective. Our next speaker is from Urban 95, And it's on the green-blue schoolyards, early childhood, nature, and climate. So I'd like to invite Julien Vaslo and Esther Go.
Hi everyone, I'm Esther. I'm the Early Childhood Development Specialist from the Bernard Venlier Foundation. My colleague and co-author Julian is here with us in the call, but I will be presenting our article for the both of us. Primarily, this article highlights a case study on the work that was carried out by the city of Rotterdam here in the Netherlands, with the aim of building sustainable and resilient cities which prioritize the health and development and well-being of its inhabitants, particularly the youngest children. Next slide, please. So what exactly are green-blue spaces? In short, they are spaces which include natural elements, either green spaces such as parks or blue spaces such as lakes, canals, or waterfronts. So with the child at the center, the city of Rotterdam implemented essentially a subsidy program to increase the amount of green-blue spaces across the city. Next slide, please. In this project, its core vision was found at the intersection of three quite strategic goals. One, making the city more child-friendly, to increase urban greening, and three, to improve the city's climate adaptation. The success of the project was really due to, there were 5 key elements to it, but primarily strong technical support, local technical support, the commitment of the schools towards the shared vision and towards developing green-blue spaces within the school, and also the ability for the city government to bring different funding streams together. This is quite a unique point where they were really playing and identifying common benefits across climate, across early childhood, and across urban planning to unlock larger amounts of funding. Next slide, please. Looking outside of the Netherlands and outside of a more Western context, much closer to Asia and to home, we have examples within Asia which are worthy to be highlighted as well. One key example here is the restoration in Seoul of the stream that you see here. This is a project that shifts political priorities from a car-centric city towards a more people-centric city. In essence, the redeveloped space was originally a highway, actually, which became a continuous park running along 5.8 kilometers of Seoul's downtown area and connects neighborhoods through 22 bridges. Next slide. This project happened some time ago, but right now what we know from it is that vehicle volume has actually decreased 45%. Public transportation use along this area has increased by 15%, and pedestrian activity has increased by 46%. These all point towards a much more active engagement with the space. And next slide. From climate adaptation point of view, we also understand that 95% of the waste from the demolition of the highway was salvaged and reused. It's actually led to a reduction in urban heat island effect. It's led to a reduction in pollution, as we can see here, and an increase in biodiversity, especially within the stream and along the city. Next slide. Quite crucially, though, what this means for early childhood development, what this means for most of us here in this call, is that we as a community have quite a critical role in surfacing the needs of the youngest children. The reason I shared this is also for us to consider the types of interactions which are critical to child development, which a lot of us know and are very familiar with. What we can do, the connections we can build at every level, including the urban space, And then we can begin to understand the importance of this urban setting in strengthening these connections for babies, toddlers, and caregivers. I think one of the key things that we constantly think about when we think about nurturing care, when we think about nurturing interactions between caregiver and child, there's often the background of the environment, whether it's the indoor or outdoor space, which plays such a critical role. And with that, I wanted to close off the sharing with leaving you with a question of what can we actually do in our cities to include the needs of babies, toddlers, and caregivers within city planning and projects. So thank you very much. I'll pass it back to Sarah.
Thank you very much, Esther. It's really interesting to hear about concrete ways that you were able to shape the environment for young children. And maybe we can talk more about some of the implications for Asia afterwards, Asia and the Pacific. Our last presentation by the paper presenters is by Karma Gile. Over to you, Karma.
Thank you, Sarah. Kusuzongbola, everyone. Yes. And my article highlights the policies and principles related to environment protection and climate change in Bhutan and how it drives programs and policies related to early childhood development. Next, please. So, climate change is real, as each one of us experience in our own lives, as well as we have heard from the experts who spoke before me. Rising temperatures, receding glaciers, rising sea levels caused by relentless pollution of the planet. In fact, we are breathing in the very air that we poison. Next, please. Next. Yeah. But of greater concern is how our actions impact our children and their future, the well-being and future of children who are born into the mess that we create. Our children are exposed to increased risk of infectious diseases, malnutrition, stunted growth, and dirty air that impedes their development. Next. In my country, we have been fortunate to have visionary leaders and strong policies that recognize our rights to clean air and water, as enshrined in the Constitution and the so-called gross national happiness philosophy. This is the reason why we are often called carbon negative, which simply means that we absorb more carbon than we produce. The achievement has not just come naturally. There are trade-offs, and we have made efforts to make sure that values and principles are integrated across all programs and plans. Next, please. In early childhood development, with regard to early childhood development, we have the mandate, as per the policy, to promote the same in our early childhood policies, standards, curriculum, and day-to-day ethos and practice of early childhood centers and programs to raise individuals and communities who protect and care for the environment and live sustainably with strong environmental ethics. Next, please. So, my paper highlights what we in early childhood programs and centers do to enhance this in terms of practical measures and steps that we take on a day-to-day basis, as well as in the standards and policies that are in place. Next, please. Can you go on to the next slide? Yes, yes, thank you. So although we have been successful, the sad truth is that climate change knows no geographical or political boundaries, and what affects the world affects us unless everyone works together. Just as children are affected for no fault of theirs, even as we make efforts, we are affected by the brunt of climate change and pollution. That is why, while we know that what a small country like Bhutan does cannot change the world, we do it believing that we can still make a difference, even if we can help a few people and a few countries understand what we are hoping for our children and their future. So, thank you.
Thank you very much, Karma. Bhutan is really an inspiring country from this regard, and looking at this dimension of children's environment. I would now like to, there's now space for question and answers to our different presenters. And so you can, please feel free to write any questions that you have for any of the presenters in the chat. Maybe we can start with, I will phrase, there's a question a comment in the chat, but I can phrase it as a question, which is, actually, so this one would be for Esther and Julien, and it would be about, look, how can we consider the opportunities that you've identified in your programming in urban settings and be able to apply that maybe in other urban settings?
Julian, I wonder if you want to take this question?
Hello, yes, sure. Sorry, I was trying to unmute. So opportunities, how can we, the question is how can we find and multiply or replicate the opportunities to other places? Is that correct, Sarah?
Yes, that's right.
Right. So I think that the opportunities that can be applied for connecting urban planning and thinking around urban planning and better nature in cities to early childhood development. First of all, they should be connected to an understanding of the situation of the city itself. So I think what we do a lot in our work and supporting cities in the Urban 95 network is to look at where do they have challenges related to early childhood in relation to the physical space, identify those, and then apply solutions that can be that can work locally. So to give more concrete examples, in some cities, there will be, like Esther presented, an opportunity to expand the park, and then it becomes about where does that park connect to the various places that are important to families with young children? Does it connect well to where neighborhoods where young people live, or does it connect well to childcare or healthcare or places that pregnant women need to access most, so that we improve the routes and the places they use the most? And that requires an understanding of the patterns and the uses of space by the specific population we're talking about. In other places, it may actually not be always the physical environment, even though we're talking about it today, but it can be something that starts in another field, for example, childcare or service location, and thinking about where with the administration in charge of these services for young children, and then introducing that spatial discussion to them and saying, actually, you're thinking about childcare provision, but how can you integrate within the childcare centers or the schools, like we've seen in the presentation by Esther, or around it, some elements of design or access that will improve the quality of the environment around these places. So I think a long way to answer the question is just to kind of understand first and assess first the quality or the challenges, let's say, of the spaces that we're talking about, and identify opportunities that are going to work in that space rather than trying to replicate things that may not always work everywhere. So that's the particularity of urban planning. It's very location specific by definition. Hope this answers your question.
Thank you so much, Julian. It's really good to be able to start to think about the urban environment of young children. We have a question for Karma, actually 2 questions. One is, what is the Bhutan strategy for early childhood? And also, do you have any component of the curriculum that is related to the environment in the curriculum?
Okay, thank you for the question. In terms of early childhood strategy, yes, the holistic early childhood development framework is grounded in the nurturing care framework to ensure that there is all the areas, the 5 areas of early childhood development are addressed. In terms of relating our policies and strategies with the curriculum and practice, basically we promote, we highlight these competencies as standards in the ELDS, where we specifically have the competencies highlighted so that children acquire these competencies. And also these principles are highlighted in the curriculum in terms of day-to-day activities, where we make a strong emphasis on place-based education, learning from and with nature, and also using sustainable play materials, for instance, low cost and no cost learning materials that cause no harm to the environment. I hope I have answered the question.
Yes, thank you very much, Karma. Dr. Park and Bernadette, would you like to take the next question? What strategies have worked to make the case with governments and strengthen political will to address the issue of air pollution with regard to ECD?
Dr. Park, would you want to go first to answer?
So, as mentioned by in my presentations, WHO produced the 2018 as a summary of the scientific evidence, and then WHO adopted several resolutions in World Health resolutions for urging each member states to adopt comprehensive policy to improve the air quality in their country, and by including monitoring the air pollution situation, and also set up a long-term plan to remove the air pollutants. And the WHO country office, including my office in Vietnam, is helping the government of its member state, including Ministry of Health and the Ministry of the Environment, to develop and implement its comprehensive national action plan. I think that is something I can say to you. Maybe it's or not from WHO Geneva, I can add something from the WHO headquarters global view.
Thank you, Dr. Park. What I would like to add at this moment is that there are the national commitments and the translation of that, as Dr. Park has spoken about. Then we also have the international mechanisms that enable countries to make commitments collectively and have accountability with it. So the United Nations Climate Change Conference that takes place very regular is one of those mechanisms, and we have seen sort of the strength of that for countries to provide inspiration between each other. Sarah, colleagues, my colleague Marie-Noël, who is a technical expert and working day to day on these issues, will speak later, so she may give some more reflection also on practical examples that have been working in countries that we can take inspiration from for this question. Thank you.
Thank you very much. We have a question about the ocean acidification, because I think this was a new topic that came up for us, and even when we were working on ARNEC Connections, it was very interesting to us. So one of our questions was, how, like, to what extent is this a new area that we need to that you need to advocate for, or is it quite a well-known area? And how do you plan to use these results, and what is the best way forward?
Thank you. I will start giving you some examples of what we've done already here in the UK. One of the things we have been raising awareness is with the local schools during the Science Week, in which we go through the schools, we have specific experiments, a specific understanding. I think for us, the ocean acidification aspect relates very directly in connection to the commercial species, which are the species that people naturally here in the area consume. So there is an aspect of obviously protein, but also omega-3 and the importance of the overall nutritional value. As the oceans are starting to change, we will see some of the changes in the carbonic chemistry of the seawater, which will have implications for some of these commercial species. Some of the work that we have been doing, for example, in Latin America and Chile, for example, we have looked at what are the likely effects of size, of taste, of appearance, but also nutritional value in some of the commercial mussels, for example. So as we're starting to look into some specific changes with regards to scenarios, some of these species are going to have some effects. So therefore, there will be some implications for diet, for feeding, for jobs. So it's something that absolutely I would, in regards to your question, definitely we need to look into it, specifically with education in mind. I don't know if Maria wants to expand on this as well.
Yes, I think I would like to say that as the preservation of the ocean is part of the SDG Agenda 2030, and it appears as a separate SDG, we were discussing the topic, and we thought that perhaps because ECD provides an entry point to any of the objectives of the agenda, and we advocate for multisectorialism, we wanted also to bring the attention and raise awareness of the importance of the oceans. All over the world, children live near coastal areas. Changes are happening. And because we don't see the transformation of the oceans through the process, through a chemical process, we just see the effects. Somehow we haven't taken as many as precautions that we have taken from other aspects of promoting a safe physical environment for all children. I think this is important. Although I think what Silvana was explaining, we are doing small steps, and all over the world, people are doing small steps trying to link how to raise awareness, and starting by the children, because for them, they are the next generation. They are the children who don't drive cars, children don't smoke, children do not light fires, or at least they do, but in a minimum, not necessarily for example, for preparing food or anything like that. But if we raise awareness, we strongly believe that we can advocate for a safer and healthier environment for children. And as I said in my presentation, we call upon the big producers of CO2 to think about this. There's other effects that we don't see visible, but we are starting to feel the effects. And I think that's important for policymakers, and that's important for multisectoral work, and that's important for integrating this other SDG that is there and is also part of the life of everybody in the planet. Thank you.
Thank you very much. We really look forward to reading all of your articles. We have invited two guest speakers today, Marie-Noëlle Brunet-Dries and Sonia Medina, to respond to this issue of ARNEC Connections and share their perspective on how we can ensure the well-being of young children amidst environmental risks in the Asia-Pacific region. Marie-Noëlle Brunet-Dries works at the WHO Department of Environment, Climate Change and Health in Geneva, Switzerland. She is currently the focal point for children's environmental health.
Thank you very much, Sarah. And thank you so much for inviting us today. I mean, this is quite a milestone for us to be able to work together on creating healthier environments for children, and to seeing all this wonderful evidence and articles and materials that are being created by ARNEC. So as we saw in the presentations today, there are important threats to child development. There are many important threats. Many of them we touched upon here, major ones. There are others. Einstein used to say the environment is everything except me, which makes it very big. But at the same time, I think one of the key messages I got from today is that most of these threats have actions associated to it, so we could do something about them. We have heard about the need for clean air for children, about the impact of climate change and ocean acidification, the effects on the environment, about how schools can be health promoting through simple interventions, about how countries can themselves address these complex issues, even something as complex as climate change. As we have heard, we have about 25% of our young children dying today because of environmental causes that are preventable. We have about 26% of the burden of disease that could be reduced if we worked, if we intervened in the areas we heard of today. We also know that a lot of these exposures, as Bernadette explained, start in the womb already and can have an impact in the lifetime. We know the environment works with the genetics of an individual to actually alter the way to alter our genetic expression, and then that can lead to future diseases. I think we started, I've been working in WHO in this area for some years now. And I remember 10 years ago, we were really trying to tell people that climate change was not about polar bears, it was about human health. I think today we have advanced, and this is quite clearer. And also, I don't even think it's just the face of a human, it's the face of a child. Climate change is the face of a child. So I'm pretty happy to see how we are advancing in raising awareness and going into action at the same time. I think the SDGs that were also mentioned earlier on provide us with a unique opportunity, because many of these SDGs, Sustainable Development Goals, deal with the different risk factors we heard about today. And actually, by acting on these goals, we'll be protecting the health of people, and we'll be acting on Sustainable Development Goal 3, which is the one about health. So we have also been hearing lately a lot about the children themselves. They have been marching, they have been asking us to protect the climate. We need to protect our climate and decrease our air pollution. That's a crucial step that we need to take, as we heard today. We welcome advances and commitments from governments. And one of the things, I think, one of the questions related to what can we do? And I think Bernadette started saying that, and also Dr. Park, that it's really important that we implement what is agreed at the different COPs, at the different conference of the parties, and things like the Paris Agreement. Dr. Park also reminded us that we need to establish and enforce air quality standards in line with WHO's air quality guidelines, both for household and ambient air pollution. Household air pollution being an important, being one of the big generators of ambient air pollution as well. We need to develop coherent multisectoral policies and actions across transport, industry, power generation, agriculture, housing, education to prevent air pollution, and also develop and implement policies to ensure that clean fuels and technologies for cooking, heating, and lighting in households and schools are available. We again need to use the leverage of these international agreements and also of the World Health Assembly resolutions that we have in these different areas. We have one for air, for example, and I think we really need to use the numbers and the evidence that we constantly create on the health impacts and also the health gains that we could have from taking actions. I wanted to just mention in 2018, we had the first WHO International Conference on Air Pollution. And we had a mayor there from an Eastern Europe city that said that they had an old parking lot that was crumbling in the middle of their city, and they didn't have much funds, but they wanted to create a healthier city. So they took out the parking lot and they built the park instead, which didn't need a lot of funds. But then they didn't have money to make it a nice park. So it invited everyone in the city to come and plant their own trees for a special occasion, an anniversary or something. And now that's probably the most attended park in the city, and it's created a big green space, and people like it and they take care of it because they feel it's their park because they've planted their own trees and their own bushes. So I think, as we heard earlier on, there is not one single solution, but I think we can be creative in finding many solutions. One of the things that we didn't hear, we heard in the beginning, but we didn't develop so much here, and I just wanted to highlight, was the one on chemicals. We know today, especially, we have two big neurodevelopmental centers for child development. These are lead and mercury. I won't dwell too much on those, but I just wanted you to know that about 60% of the unexplained intellectual disability, developmental intellectual disability, is linked to lead. Lead is found still in many places, especially we find it in paint, in old car batteries, and it is stunting our children's brains, and so is mercury. And again, we have World Health Assembly resolutions on those. We have international conventions, such as the Minamata Convention on Mercury, a global alliance to eliminate lead paint, and many other chemical conventions. And all of these need to be implemented at country level. And all of this gives specific actions. The Basel Convention, for example, that doesn't allow waste to be imported into a country illegally. And all of these also need to be implemented to protect child development. We also have sometimes, and we won't be dwelling on those, but we have new issues like electronic waste, for example, that is often shipped to developing countries where it's torn apart and it's actually severely damaging the health of our young children because, again, it's full of neurotoxicants. So again, what can we do? I think we can implement the policies. We can address these World Health Assembly resolutions. We have a leverage with the ministers of health on that level. We also have these different guidelines on air, on water sanitation. We will soon have some in lead, and we need to really make sure that these levels are respected at country level. As Bernadette mentioned, we also have a lot of tools already, pediatric environmental history, training materials for doctors and nurses to better diagnose and treat children's diseases. But as everyone said today, we cannot achieve these changes alone. So I think there is the really important message is we really all need to work together in housing to ensure the clean fuel, to remove unsafe materials in schools, to provide, as we heard today, green and blue spaces, safe sanitation and hygiene, promote good nutrition. In health facilities as well, we need to ensure that we have safe water, sanitation, and reliable electricity. In urban planning, we need more green spaces, safe walking and cycling paths. In transport, we need to reduce our emissions. In industry, we need to better manage our waste and chemicals. And for the health sector, the education sector, well, for the health sector, I think it's really important that you help us monitor the health outcomes and educate others about the risks that we have heard of today. But I think both the health and the education sectors are leaders. They are heard by the communities. They are heard by the mayors. I think the mayors are really big, important agents of change at country level. And I think your voices are heard. And so it's really important that they help us take these messages forward. So as we said, we have a unique opportunity now to prevent harmful exposures in achieving the Sustainable Development Goals and protecting the young children. Healthy environments are not only about allowing young children to be healthy, they are about allowing them to achieve their full potential and protecting their rights. Last October, there was a landmark resolution on child rights to a healthy environment that was approved. So we have that extra leverage here. Healthy environments are children's rights. We have been listening to the children marching and demanding that we protect their future. So in addition to raising awareness, and this is a really important issue that we should keep doing, we need to act now. So the message to protect the young child is a unique one that will allow us to have this leverage for a new, greener and healthier society to happen. As a poet from the Pacific once said, a child's name is not tomorrow, it is today. And I just wanted to very briefly, and I will end with this, to mention again, COVID. And during 2020, our Director General issued the 6 prescriptions for a healthy green recovery from COVID. So we know we are going through a challenging time, but we must take this challenge as a future opportunity to actually make some of these changes that have been difficult sometimes to put into motion, to make them happen now, because we need to rethink a lot of the ways we have been living in. So the 6 prescriptions for COVID, I'll just mention the title. First of one is protect and preserve the source of human health, nature. The second one is to invest in essential services from water sanitation to clean energy in healthcare facilities. The third one is to ensure a quick, healthy energy transition. The fourth one is to promote healthy, sustainable food systems. The fifth one, to build healthy, livable cities. and the sixth, to stop using taxpayers' money to fund pollution. So if you go to our website, you can see all the rationale behind all of these 6 prescriptions, also numbers on how much we would gain from health, but also economically if we apply these different prescriptions, and what are the reasons why we should be really going this way. And it also comes with a set of actionables, so with very specific actions for different levels that could be taken for us to be able to ensure that we have a green world after COVID that actually protects us and particularly protects our children. Thank you, Sarah.
Thank you so much. Yes, it was really great to get your perspective on this particular topic. I would now like to invite Sonia Medina, who is the Executive Director for the Climate Program at the Children's Investment Fund Foundation. She oversees the Foundation's climate change portfolio. Over to you, Sonia.
Hi, it's really an honor to be here with all of you today, and thank you so much for the invitation. ARNEC should be applauded for compiling this report, which so clearly highlights the threats that environmental risk and climate change pose to the futures of young children. CIF, the Children's Investment Fund Foundation, it is a children's foundation and has been for the last 2 decades since its setup. And it is the largest private foundation dedicated exclusively to children's well-being. Our founder and CIF team realized early on, about a decade ago, that if you really want to make a difference for children living in poverty and give them the best start in life, you need to tackle climate change. And over the last 10 years, we have been growing on our understanding and our work in this area to the extent that now over 40% of our annual budget is dedicated to tackling climate change and air pollution. In 2020, that has meant over $150 million dedicated exclusively to this issue. As the speakers before me have very ably highlighted, clean air and climate change are of an incredibly importance for children's well-being. And it is an avoidable consequence of our carbon-intensive lifestyle. We can absolutely do more to reduce greenhouse gases and address air pollution at the same time. Addressing emissions from the power sector, heavy industry, in our cities, in our transport and large-scale agriculture are critical to reducing both work. As a result, we set up a few years ago the Cleaner Fund with like-minded foundations that work on children's issues, on climate issues, and have been seeing progress in the understanding of climate change and air pollution as a health issue. And I recommend those participating in today's work to also look at their work. We are making progress, even though obviously a huge amount needs to be done. In December of last year, for the first time, a coroner recorded that air pollution had contributed to the death of a 9-year-old child in the UK. You may have heard of Ella Kissis-Debrah's tragic death a few years ago. For the first time that we know of, now a death certificate, the very sad situation has now recorded the actual killer of Ella Kissis-Debrah, which was air pollution and the toxic fumes of traffic that she was exposed to during all of her life. But obviously, as the report highlights, there are hundreds of thousands of Ellas around the world, and we must avoid more tragic deaths. So the work of the C40 network, for example, on cities which we support, on the air quality network, a lot of the cities, many cities in Asia are members of the C40 network, is working very closely with mayors around the world to introduce policies that will address this air pollution. Again, huge amount of work to be done, and I will welcome and encourage all participants to advocate and support C40's efforts to introduce new policies. For example, London's ultra-low emission zone policy has managed to reduce in more than 45% NOx and PM10 since in its introduction, as well as 15% of CO2. When it expands, schools in the area covered by the ultra-low emission zone that are exposed to bad air will go from 450, that is thousands and thousands of school children, to zero. We will eliminate bad air from schools in London. Tremendous impact with just one policy. I am extremely encouraged by the report's highlights of oceans and acidification and the impact on food, because it is so important. I also remember a UNICEF report that highlighted the impact of sea level rise on children. And we know that climate also causes floods and droughts and extreme weather events and others that also affect malnutrition and negative outcomes. The UN Food Summit, convened by the Secretary General this year, will start also to highlight many of these intersectionalities, and I'm really very much looking forward to it as we support it. And I will also like to encourage people to look out for the pre-COP, the climate change conference that was highlighted earlier, which will take place in Glasgow in November of this year. The Italian co-host will convene a youth summit where I think many of these issues will be highlighted. I'll leave it there, and thank you so much for inviting me to address and respond to this very important report, and congratulations to the authors. Over to you, Sarah. Thank you.
Thank you very much, Sonia. It was good to get your perspective. I'll now invite Dr. Sheldon Schaefer, who's the chair of the ARNEC Board of Directors, to give the closing remarks.
Thank you very much. First of all, I'm amazed by how interesting and important these presentations are. It kind of reminds me in some ways of the work being done maybe 10, 15 years ago in terms of neuroscience and young children, toxic stress. Interesting to specialist agencies and specialists in many ways, but reached a certain point where it became a major thread of discussion around early childhood. And I'm sure that this kind of work on environment and climate change is already in the process of doing the same. I want to, first of all, thank the Secretariat and the authors and the evaluators and the presenters and the responders and the audience, Dr. Dalemans especially, for the work they've done just on this hour or so presentation. It's a lot of hard work. There has to be a bid going out, a call for papers, a selection of abstracts, certain ones chosen for further work, then evaluated, chosen again, then edited, and then published. A long and difficult process, but I think if done annually, it really makes an important contribution to the field as a whole. I want to talk first about certain key messages that we hope are found in this publication. First is that young children are exposed to risks arising from poor environmental health, disasters, and changing climates. The World Health Organization, I think, has referenced 2020, estimated that about 1/4 of deaths of children under 5 could be prevented through healthier environments that reduce key risks, including air pollution. We've heard about that, unsafe drinking water, sanitation, inadequate hygiene, as well as exposures to certain toxic chemicals, as Marie-Noelle talked about, such as lead and mercury. UNICEF in 2015 cited greater risks for the Asia-Pacific region from climate change. The majority of children in extremely high flood occurrence zones live in Asia. More than 150 million children live in zones at high or extremely high risk for tropical cyclones, with Asia by far the most vulnerable continent. Nearly 40% of the people living in areas of high or extremely high drought severity live in Asia. So Asia is especially vulnerable in issues around climate change. The next message relates to the importance of trying to nurture sustainable environments. ARNEC has taken a clear stand on the challenges mentioned above. climate change, and the environment. ARNEC not only emphasizes the interconnections between environmental health and early childhood, but also calls for multisectoral approaches and partnerships to promote the safety and well-being of young children and their families against environmental risks. First, we believe that environmental degradation erodes the potential for early childhood, young children, and also for sustainable development. Policies and programs need to respond to the interlinkages of environmental health, climate change, and early childhood development. This is an area ARNEC will continue to work on in collaboration with partners in the region and beyond. We also agreed to advocate for change in the policy environment, the physical environment, the community environment, the home environment, and these were themes of the conference that we held in Hanoi, which led in fact to the 2019 Hanoi Call to Action consensus document by more than 600 participants at the regional ECD conference of ARNEC in Vietnam in December 2019. Next, please. Another key message is that we need to build strong partnerships for early childhood development linked to the physical environment. And here the role of governments, policymakers, and the scientific community is important. The ECD community needs to reach out to experts in science to inform policymaking and implementation. There needs to be greater space for interdisciplinary conversations to understand and address risks facing the most vulnerable, the young children in the region, and to uphold the well-being of families and communities. But also the scientific community and governments also need to learn from the early childhood development community, especially about the essential foundations for nurturing care and the enabling environments required for the protection and development of young children. Finally, another key message is that ARNEC has continued its advocacy for ECD and the physical environment through ARNEC Connections. The ARNEC Connections is the main publication of ARNEC, intended to reach the early childhood development community in the region with knowledge products such as research summaries, policy and/or program insights, field experiences, process documentation, scientific inquiries, innovations and good practices, and lessons and reflections on ECD-focused initiatives. The objective is to encourage the early childhood development community to write for the early childhood development community, to foster a community driven by knowledge-seeking and knowledge-sharing culture. Therefore, ARNEC Connections is one of the ARNEC platforms to foster meaningful exchange within the ECD community in the Asia-Pacific region and beyond. So the theme for the 2020 ARNEC Connections is ensuring the well-being of young children amidst risks in the Asia-Pacific region, which reinforces the agreements in the Hanoi Call to Action of 2019. The 2020 publication covers wide-ranging topics on ECD and the environment, and you've only heard from some of them, analyzing issues such as air pollution and early childhood development, ocean acidification and climate change, policy and program innovations fusing ECD and environmental health, nature play, and urban design. All of these as entry points for investing in early childhood development, the environment, and culture. With these key messages, therefore, now please join us in the launching of the 2020 ARNEC Connections. Thank you, everyone. And now the launch is finished. See you next year.